We've all heard about strokes. They come on suddenly, and they can leave people paralyzed, unable to speak, or worse, gone. But what most people don't realize is this. The body often gives you warning signs before a major stroke. And those early signs, those little nudges, are too often ignored or brushed off. Today, I'm going to walk you through those signs in plain English. Not medical jargon, just real talk, so you know what to watch out for. Because knowing these symptoms can mean the difference between early treatment and a tragedy. Before we get into the symptoms, let's just quickly explain what a stroke actually is. A stroke happens when the blood flow to part of your brain gets blocked, or when a blood vessel in the brain bursts. Without oxygen-rich blood, brain cells start dying within minutes. And once they're gone, they don't come back. But here's the good news, most strokes are preventable. And many are predictable too, if you know what to look for. There's something called a transient ischemic attack, or TIA. Think of it like a mini-stroke. It feels like a stroke but goes away after a few minutes or hours. The problem is, even though the symptoms disappear, the danger doesn't. A TIA is often the body's warning shot. It means a full-blown stroke could be on the way, sometimes within days. So let's go through the most common pre-stroke symptoms. These can show up days, weeks, or even months before a stroke. If you or someone you know is experiencing any of these, don't ignore them. 1. Sudden numbness or weakness, especially on one side. You might feel numbness in your face, arm, or leg, often just on one side. It may come and go, or feel like a limb fell asleep. Even if it passes quickly, it could be a mini-stroke. 2. Temporary trouble speaking or understanding. If you suddenly find it hard to get your words out, or if people are talking but you can't quite follow what they're saying, that's a red flag. This may only last a few minutes, but it's a classic warning sign. 3. Blurry or double vision. Sudden changes in vision, like blurred sight, double vision, or even brief loss of vision in one eye, it can be a pre-stroke symptom. Don't just assume it's eye strain or fatigue, especially if it comes on quickly. 4. Dizziness, loss of balance, or unsteadiness. This isn't the kind of dizziness you get from standing up too fast. This is sudden and strange, like your balance is off or the room is spinning. It may feel like you can't walk in a straight line or stay upright. 5. Sudden severe headache. A very strong, sudden headache that feels different from a normal one, especially if it comes with vision changes, nausea, or confusion, could be a sign of a brain bleed or something more serious. 6. Unusual fatigue or mental fog. You might feel off, tired for no reason, mentally cloudy, or like you're moving in slow motion. People often say they just don't feel right. This can be your brain telling you something's wrong. 7. Facial drooping. Even if it's mild, watch for one side of the face looking different. Try smiling in the mirror. Does one side lag? That could be a tiny warning stroke. 8. Sudden tingling sensations. If you feel pins and needles, tingling, or a crawling sensation down your face or limbs, and it's not due to pressure or posture, it could be a signal of disrupted blood flow in the brain. 9. Confusion or trouble thinking clearly. You might suddenly find it hard to focus, make decisions, or follow conversations. This mental glitch can be subtle but important. 10. Mini-strokes, TIA, that come and go. All of these symptoms can show up briefly, then disappear. That's the most dangerous part. Because when symptoms go away, people assume it's nothing. But it's not nothing, it's a countdown. So what should you do if you or someone you know shows these signs? Don't wait. Don't Google it. Don't hope it goes away. Call for medical help immediately. Even if the symptoms vanish in 20 minutes, still call. You may need scans, blood thinners, or other treatments to prevent the main stroke from happening. The sooner you act, the better the outcome. Stroke is one of those things where every second counts. And don't forget, if someone shows the classic stroke signs, Remember FAST. Face drooping. Arm weakness. Speech difficulty. Time to call emergency services. But now you know, there are signs even before FAST. Sometimes weeks before. So here's my challenge to you. If you're experiencing any of these warning signs, don't ignore them. Get checked. Ask your doctor for a stroke risk assessment. And if you have a parent, friend, or partner over 40, share this video with them. Because prevention isn't just about eating well or exercising. It's also about paying attention and acting before it's too late. Thanks for listening. Stay sharp, stay safe, and I'll see you in the next one.